All right, so we'll move on to the cognitive approach treatments. These treatments teach clients to think in more adaptive ways or essentially change their way of thinking about the world and themselves, which is typically they're engaging in dysfunctional way of thinking. So this approach assumes that psychological disorders develop from negative emotions that come from incorrect thinking about the world or the individual themselves. This treatment is typically administered over a few number of sessions, usually less than 20, and they are highly structured sessions with the therapist playing a very active role and guiding the patient through the sessions. This approach has been shown to be successful in treating a variety of disorders such as anxiety, depression, substance abuse, eating disorders. And this approach tends to be effective um, as cognitive psychologists are quite willing to incorporate other approaches with their treatments. So, this willingness to sort of incorporate different approaches increases the overall effectiveness of their treatment. The first technique from a cognitive approach is known as cognitive behavioral treatment, or CBT. So these are derived from both behaviorist and cognitive approaches. So it combines the two essentially. And there's a focus on changing the dysfunctional or inaccurate thought patterns of the individual while also focusing on a detailed analysis of the problem behavior and what is going on in the individual's environment that might be associated with that behavior. So, this therapy again is conducted in a short amount of time, with the overall goal being to change the irrational thoughts and change the problematic behaviors that the individual is engaging in. And this has been shown to be effective for a variety of disorders such as depression, OCD, panic disorder, insomnia, and many others. A second technique from the cognitive approach is known as rational emotive behavior therapy, or REBT. This therapy challenges the individual's dysfunctional behavior with the goal of restructuring their belief system of their world and of themselves. So, trying to restructure their thinking to a more realistic set of views rather than the dysfunctional ones that they have. The main assumption here is that these irrational beliefs or thoughts the individual has actually trigger some negative emotions, which then support the irrational beliefs, and it just goes around and around in this sort of self defeating cycle. So, for example, a person with irrational thinking might fail their first exam and think, I'm stupid, I'll never pass this course, I'll be a failure for life. And this way of dysfunctional thinking can lead to depression, maybe dropping the class or dropping out of school altogether. And it ultimately leads to emotional disturbances in the individual. Whereas an individual who engages in rational thinking might fail the same test and say, well, that was unfortunate. I didn't study very well, so I'll study for the next exams better. And they move on with their life. So, REBT uses a variety of techniques to alter the individual's irrational thinking, and you can use the acronym ABCDEF. So, we have activating events, beliefs, consequences, dispute, effect, and further action. So, each of these represent a step in REBT. So, here's an example of a patient suffering from anxiety surrounding tests and or school. So first, the patient and therapist discuss the activating event. That's the first step. So in this case, it would be sitting down to study. Then they discuss the patient's beliefs about herself if she fails the exam. So that's the second step, which results in the consequences of this, which usually produce some sort of anxiety. So then we move on to the dispute step. This is where most of the therapy takes place, where the focus is on disputing the patient's belief of having to get an A no matter what. And if she doesn't, she has these negative feelings about herself. So the goal here is to change this way of thinking to a more realistic way of thinking. And the effect of this usually leads to less anxiety. And finally, further action refers to the fact that typically patients need to repeat steps A through E several times until their anxiety levels are decreased permanently. And finally, we have the humanistic approach. So this focuses on the relationship between your self concept and your actual experiences. The main assumption of this approach is that people have control over their behavior and they can make choices about their lives and are essentially responsible for solving their own problems. A technique from this approach is known as client centered or person centered therapy, which involves unconditional positive regard. So, person centered therapy helps clients accept the difference between their ideal or perfect self and their actual experiences by using what is called unconditional positive regard. So, this is where the therapist provides full acceptance of the patient with absolutely no judgment, no matter what the patient says or expresses or does. The goal here is to create a safe atmosphere so the patient can come to decisions on their own and improve their own lives. One of the main proponents of humanistic therapy was Carl Rogers, and he focused on the individual's self concept and their own subjective experience of the world. From his viewpoint, people have a natural tendency towards self actualization. So if patients are allowed to fully express their problems and their feelings, then they will be enabled to make realistic and constructive choices and decisions about things that bother them in their life. So here, the point is that therapist is not directing the patient, which is what is done in many of the other approaches, but rather they're simply given the space to come to the conclusion on their own. There are three elements that facilitate self actualization. So, first is what we just mentioned unconditional positive regard. So, the patient is given acceptance regardless of how they behave or what they say. The second element is genuineness. Here, the patient is given an environment to freely express their own sense of self, which essentially allows the patient to be themselves, right? They have a completely safe space to express themselves in. And the third element is empathy. So, this is the ability of the therapist to understand the experience of their patient from the patient's point of view. So, from the humanistic approach, the quality of their interpersonal relationship and encounters with the patient are more important than actually doing things to the client in terms of therapy. Okay. So, they're more focused on having a genuine relationship with their patients, having empathetic understanding, providing a safe space with full acceptance and no judgment. So, in this therapy, the client takes the lead and really directs the course of therapy. They're constantly encouraged to explore their feelings and sort of lead where the therapy goes. So, the therapist from the humanistic approach takes a very passive role. Although this therapy does create a very supportive environment for patients, the treatment overall lacks specificity. So it's really hard to pinpoint exactly what element of treatment results in the behavior change in the patient. Additionally, it has a lot of problems that are similar to psychoanalysis. It's not a scientific approach to treatment, and it is hard to determine how well this works. And like I mentioned, why it is working or what element of the therapy causes it to work or not to work. All right, so aside from the biological and psychotherapy approaches we discussed, there's also group and family therapy approaches. So, group therapy involves a group of people that meet to discuss similar problems often revolving around the same difficulties. So things like drug or substance abuse, depression, grieving the loss of a loved one, and so on. Although this therapy is more economical than individual psychotherapy, it does lack that one on one interaction. So you may get clients that might not interact at all and may even withdraw further. We also have family therapy, which focuses on the entire family rather than one individual and the dynamic between all the individuals within that family unit. The family is viewed as a system, with each individual contributing to the system as a whole. And typically, the goal of this therapy is to generate new constructive roles and patterns of behavior for individuals within the family unit, hopefully resulting in a more positive dynamic. And that is it for chapter 13.